Good afternoon, everyone. My name is Lourdes Gin. Today I will be talking to you about the effects of hazardous drugs. Hope you enjoy this presentation. At times, healthcare workers have to expose themselves to conditions that might not be considered safe, whether it is exposure to hazardous chemicals and drugs or an accidental needle stick. Nurses administer medications that are considered hazardous. Apart from chemotherapy drugs, these drugs include biotherapy, antibiotics, immunotherapy, and hormones. According to the Center for Disease Control and Prevention, about 8 million healthcare workers may potentially be exposed to hazardous drugs. A drug is said to be hazardous if studies of animals or humans show that an exposure to the drug creates a health risk. Even though the majority of hazardous drugs are cytotoxic drugs used in chemotherapy, they can also be used for other indications. This makes it very important for all nurses to know the risk of exposure to hazardous drugs and how to prevent adverse effects. There are 5 different classifications for hazardous drugs. Carcinogenic drugs are capable of causing cancer. Genotoxic drugs are capable of damaging DNA or lead to mutation. Teratogenic drugs are capable of causing damage to a fetus or embryo. These drugs can also cause reproductive toxicity, leading to infertility or miscarriages. Organ toxicity was also noted at low doses in animal studies or in treated patients. Exposure to hazardous drugs may occur through dermal, inhalation, ingestion, and injection. Dermal exposure can be through touching any surface that had drug residual. Inhalation of hazardous drugs can occur when aerosolization or vaporization of drug occur. This is most common when opening a vial or when mixing the drug. Ingestion is the least common route of exposure. This can be through hand-to-mouth contact when eating or drinking, smoking, or when applying cosmetics. Injection exposure can be from an accidental needle stick or a sharp exposure. According to Meehan, nurses are more likely to be exposed when spiking or unspiking intravenous solutions and through direct skin contact if a spill occurs. The risk of exposure depends on how long the person is exposed to the drug. Acute symptoms reported from healthcare workers include skin irritation, sore throat, cough, dizziness, headache, hair loss, allergic reaction, diarrhea, nausea, and vomiting. The 3 main adverse effects from exposure to hazardous drugs include mutagenicity, cancer, and reproductive effects. Because of the increased risk of adverse effects associated with exposure to hazardous drugs, nurses need to be aware of safe handling precautions. Safety precautions include safety cabinets for drug preparation, 2 pairs of disposable gloves, a disposable gown, an approved respirator, an eye and face shield, a policy and procedure handbook, and training to those using hazardous drugs. The work area where hazardous drugs are prepared should be restricted and warnings should be placed around the area to increase awareness. Drugs should be transported in a labeled, closed transport receptacle that can contain spillage and avoid breakage of drop. After administering hazardous drugs, precautions should still be maintained since metabolites are excreted in urine, feces, and sweat. According to Nixon, using personal protective equipment when handling body fluids and linen is recommended for the first 48 hours after the completion of drug administration. Even though these precautions are in place, many nurses lack adherence. The study performed by Pavlovic and Martin explained how nurses were provided with chemotherapy designated gloves. However, some nurses use latex and vinyl gloves instead. The study noted that gowns were only used by 62% of nurses when handling drugs and in 52% when administering the drug. Gowns were less available in private practices compared to inpatient hospitals. Double gloving was the least precaution used by nurses. Those who reported double gloving worked in institutions where the safe handling policies had been updated. Eye and respiratory protection were readily available compared to other personal protective equipment. A different study performed by Pavlovic and Clark concluded double gloves, eye protection, and respiratory protection rarely were used by nurses. The goal of the mentioned articles was to provide information and to describe the use of safety precautions by nurses who handle hazardous drugs. From the above information, one can see how protective equipment is usually available in most settings. There were occasions where employers did not provide the adequate equipment. Any healthcare organization using hazardous drugs should provide protective equipment. Nurses are unable to use equipment unless it is provided. This topic opens possibility for research and use of evidence-based practice. For example, the 3 articles provided knowledgeable data. However, all 3 lacked information regarding the barriers to implementation and safe handling. This topic was not fully explored besides equipment not being available to employees. Different organizations influence the use of protective equipment, and the use varies throughout organizations. This influence can be an area to focus on for future research. The use of hazardous drugs continues to be a risk for nurses who handle such drugs. Nurses and other healthcare workers who handle these drugs should have adequate and up-to-date information and training to decrease the risk of adverse effects. Failure to use proper equipment can result in unwanted exposure to hazardous drugs. The cited articles showed how the majority of healthcare providers do not properly use the required personal protective equipment. The articles also noted how equipment was not made available to employees. Safe practice is a shared responsibility between employers and employees. The purpose of sharing this information is to alert and increase awareness among healthcare workers and their employers about the health risks associated with hazardous drugs. Thanks for watching, and I hope you have learned a little more about hazardous drugs and the effects these drugs may cause. Happy holidays!